Hello. If you've been told that your knees are bone to bone and that you might need surgery, but you're wondering if you should get it, then you've come to the right place. This is Dr. Lin with Empowerment Physical Therapy. Today, we're going to talk to you about whether or not surgery is something that you should consider or not if you have bone on bone. First and foremost, if I've been told that, and this is something that we hear quite often from the patients that we've seen that do have knee pain. And one of the first things that we get from time to time is, "Hey doc, the X-rays I've had has said that, and my doctors told me that my knees are bone to bone and that I need surgery, but I don't want to have surgery." And one of the first things I would say, and I'm biased in that sense, where I would start conservative before I go invasive. What that means is I would try to exhaust all my sort of conservative efforts before I go invasive or go under the knife and have that total knee replacement. Because I know that option will always be there for me. So some of the conservative efforts that some of our patients have taken advantage of is, POO therapy is an excellent source of exercise for your knees if you have bone on bone. And it's a great way to build strength without putting the load on it. The second thing that I typically like to have a conversation with my patients about is the results of x-rays. And I'm going to make a reference to a study they've done in the past where they've looked at backs, particularly looking at backs, where they would look at MRIs of backs. And what they would do is they would take a MRI of individuals who are walking on the street, who have no complaint of back pain, and they would put them under MRI. And they found that individuals who sometimes don't have back pains, they might have bulging disc. Their structure might look terrible on the MRI, but they feel fine. So what do? Most of the time they'll leave it alone. If it's not broken, why bother? And then they've looked at studies of people who are in a lot of chronic low back pain for years and months sometimes. And the way their image comes out is it's fine. Structurally, there's nothing wrong with MRI. They couldn't find anything on there. So what do you do with that? How do you explain that issue? So what I usually like to say is that just because the MRI, either one way or the other, tells you one thing, that doesn't necessarily translate into how you feel. What I'm more concerned about is how you feel at the end of the day, rather than what that image says sometimes. So, and that image is more of sort of taking a picture of your body in time, and realize that your body, your body changes over time. So that image is no longer the way it would be 3 months, 6 months down the line. The last things I typically like to tell patients is to consider if their knees are bone on bone, that are they able to do all the things that they want to do? Are you able to do all the things that you want to do on a day-to-day basis? For instance, I'm currently working with a 90-year-old lady whose knees are bone on bone. I hear that regularly, but it doesn't bother her. I help her get up and down the stairs, walk backward, pick things up from the floor. There's no doubt her knees kind of crack every time she bends down, but that doesn't bother her enough, and she doesn't have pain. And she's not going to get surgery, obviously, at that age and time. So just because she has bone on bone, but she feels fine and she doesn't want surgery. On the other hand, I've had a pleasure of working with another lady of ours who is bone on bone, has walked in wheelchairs, have walked out in bilateral crutches. She's a candidate. She's absolutely a candidate for a total knee replacement because she's in dire pain. And I think that's going to give her the benefits. But she does not want to have surgery. And we've tried physical therapy and conservative measures. And over the course of 6 to 8 months, we were able to get her to get down on the floor, get back up, get rid of one of the canes. But over the course of the pandemic, she had stay home and had regress. And is now, she had a couple of sessions of therapy at the same time. And now it has been back to actually been recommended by a doctor to do surgery. And she finally got one of them done. She's going to have another one done. So she's there, depending on those are the three things I would kind of consider. If your knee has indicated that the x-rays of your knees indicate that they're bone on bone, and to summarize I would start with conservative effort first before I go invasive. And then secondly is to kind of consider the fact that the image doesn't necessarily, how do you feel? At the end of the day, how do you feel, regardless of what it says on the MRI or the X-ray? And then thirdly, are you able to do all the things you want to do on a daily basis? Whether it's taking a walk, hanging out with grandkids, going on a hike. Those are the things I think you should consider. And that if you're not able to do all the things that you want and don't have the quality of life that you want, then it makes sense to consider that option and then get a second opinion about it. If you want to be empowered with the mindset, toolset, and skill set on how to recover from injuries, stay mobile and independent, and lead an active lifestyle for many years to come join us on the show. I won't tell you the button you need to click, but I'll give you a hint. It starts with an S. And if you have any questions about what to do, if your knees are bone and boned, I like to offer you a complimentary discovery call. There's no obligations to move forward unless you are ready. This is a chance to really kind of get some help advice on what to do next so that you can make the best decisions for your health. You can give us a call at 917-300-9846 and then tell our front desk gal that you're interested in booking a discovery call with Dr. Lin. All right, I look forward to seeing you. Take care.